We often get to hear patients saying that just when they got pregnant or toward the third trimester, the TSH values have risen. So what is the reason behind this? In today's episode, we will be discussing about what triggers hypothyroidism during pregnancy, what are the symptoms of the same, what are the foods to be avoided, what are the complications of the untreated hypothyroidism during pregnancy. Talking about hypothyroidism, what exactly is it? It is nothing but a sluggish thyroid or a thyroid gland that is being constantly attacked by the autoimmune mechanism, which leads to Hashimoto's thyroiditis, again in which the thyroid gland is weak and sluggish. Now, under such circumstances, it automatically affects the functioning of your uterus. Now, it can either lead to anovulatory cycles, wherein there is no ovulation happening, or it can even lead to infertility because there is lack of ample amount of progesterone. So what do we do under such circumstances? Especially when the body's requirement is going to double when you are about to get pregnant. Ideally, you should be preparing your body before you get pregnant so as to prevent hypothyroidism, especially if you are prone to it. Say for example, you had a history of hypothyroidism during your young years, or genetically if you are prone to hypothyroidism, say somebody in your family is having hypothyroidism, then the chances of you getting hypothyroidism are quite high. Or when your life is quite demanding, like there is a lot of stress, there's a lot of physical demands, your sleep is hampered, then under such circumstances, if you fear that hypothyroidism can happen to you, then the best thing to be done is to undergo a preconceptional care, wherein your gut health is being reset, your thyroid functioning is made prompt, and also your overall health is being reinstated. In that case, the chances of you getting hypothyroidism are next to nil because your entire body has been serviced and they are functioning at its optimal. Now, talking about what are the factors that makes you prone to hypothyroidism during pregnancy. If just before that you have had a very stressful or strenuous period, be it physically or mentally, like your work has been demanding, your life has been quite demanding, or you have been having a lot of junk food such that your gut health is affected, or if your sleep-wake-up cycle has been affected, that can also make you more prone to hypothyroidism. Then in that case, it is best to undergo the previously mentioned preconceptional care as per Ayurveda, reset your health, and then get into the phase of pregnancy. What are the common features observed when you have hypothyroidism during pregnancy? Bloating, extreme puffiness, swelling, constipation, dry hair, frizziness of hair, hair fall, and water retention. These are some of the common features that you can immediately experience when your TSH has risen. Then in that case, do not refrain from taking the right measures, be it in the form of synthetic thyroid pill or meeting your Ayurvedic physician who can help you reset your gut or the Agni in other words, and thereby helping your thyroid functioning get better. Now, there are certain foods that can hamper the functioning of your thyroid gland. Predominantly cruciferous vegetables which contain goitrogens, followed by millets, especially pearl millet, and soya milk. These are the common foods as per the modern nutrition which is best to be avoided. Ayurvedically, you should be ideally avoiding hybrid variety of wheat. Instead, you can use the Khapli variety of wheat which contains lesser amount of gluten. Second thing to be avoided, Viruddhahar. At any cost, keep aside the Viruddhahar because that is one of the commonest factors which leads to the sluggishness of the functioning of thyroid gland. Third and the most important one, avoiding tough to be digested dairy in the form of cream, cheese, thick milk which you are unable to digest. Now, if you can refrain from these foods, take care of your metabolism and get it tested every 3 months such that during the first trimester, if the TSH values are between 0.2 to 2.5 and during rest of the 2 trimesters, if it is between 0.3 to 3.5, then you're on the safer side. If you have any more doubts, do let me know in the comments and I shall try to help you out.